Yes, I'm pharmacist Lawrence Ekato. I am the chairman of the Association of Community Pharmacists of Nigeria, Lagos State Branch. The association is a group of pharmacists that practice in the community. And as pharmacists, it is our utmost hope and belief that we can be partners in achieving the universal health coverage in our nation. So as pharmacists, that is one of our cardinal agenda, to be a core member of the health team that helps to attain universal health coverage in Nigeria. We are saying that the members of the public should make sure that anything that has to do with their medications, their drugs, they should consult a pharmacist. And the pharmacists are everywhere. They live where they live, they work where they work, so they are accessible to the generality of the public. So we believe that our members, the community pharmacists, are readily available and waiting for the members of the public to access their quality drug needs everywhere and anytime they need it.
I am Dorcas Olukemi Shonibare, Director of Nursing Services, Lagos State Ministry of Health. Today's event is the handing over of the old chairman of AGPNP and the taking over of the new incoming AGPNP chairman for Lagos State. And the full meaning of AGPNP, Association of General Nursing Practitioners. My advice to the incoming chairman is that the incoming chairman is not new in the game. So he's somebody that has been there before. So now that he's coming in again, I look forward to work with him at the state level, okay? And just as the outgoing chairman is lamenting seriously that his activities in order to serve adequately affected his personal business. So I also want to encourage him that certainly it may affect him, but I know he has a bigger facility. So certainly it may not affect his own business, but that he should devote more time to attend all necessary meetings and bring to bear his experience in private practice.
We all know that until we fix this primary care issue, we are never going to get the type of care our patients deserve, our country deserve, right? My specialty is actually in safe and effective nursing practice. So I look for opportunity to speak about safe and effective nursing practice everywhere. As much as they love nurses, I know we do get some complaints here and there, but look at your own community, how much respect they give you in your community. I know when we get outside that people are complaining on the news, we hear all these buckets of complaints and everything, but they do respect nurses even in Nigeria. They really appreciate what we do. With all this comes responsibility. And I'm talking to registered nurses now. When we have that license as registered nurses, it comes with the responsibility of doing what is right. And for us as private nurse practitioners, encouraging quadri. I know that we talked about this. I think we should search ourselves. And we cannot be speaking from both sides of our mouth. We want to improve nursing practice, and we have found. I know this is not only peculiar to nurses. I know doctors do it too in some private hospitals and everything. But let's talk about our own. When I'm in any gathering and we are complaining about pharmacists and doctors, it's as if I'm supporting the other discipline, but that's not the truth. The truth is, let's fix our own house. Let's take care of nursing practice the way we practice.
I'm Dr. Esther Oshinluyi, a registered nurse. Really interesting. I've been collaborating with this association for a few years now, and I've been like a friend to the outgoing chairman, Mr. Olaifa. What stands out to me with this association is the ability to collaborate with other interdisciplinary team. They are collaborating with policymakers, government, public, private, doctors, pharmacists, lab scientists, and every other person in the healthcare space. And that is the way to go in actually improving the health of our people in Nigeria, is the ability, it is the leadership of this association that is actually driving this, the ability to collaborate with other people so they can move this association and by extension, the healthcare of our people forward.
I'm Dr. Makinde Akilemi-Bola, the chairman of Association of Nigerian Private Medical Practitioners. I can see that it's glorious. I came in a little bit late, and it's really painful to me that I came late. But I can assure you that I was here with them in spirit, and I can see that all of them are looking happy, and they are happy that they are doing this. So I do congratulate them for this ceremony. The rallying point for every one of us is the patient, and it is how we take care of the patient that is important. So collaboration, cooperation between the two associations is very germane in order to have a better management of the patient.
Olawale, I really welcome you, and I know that you will do the best for us.
Abalogun Ajiboye is my name. I'm the president of the Association of General Private Nursing Practitioners of Nigeria. As you all know, we are the pivot of in hospitals in providing care for the patient in Nigeria, in fact, all over the world. And the only way we can improve with what we are having now is by recognizing nursing. We are contributing so much, but we are giving peanuts. And every woman being needs incentive. If you want to get the best out of nurses and midwives in Nigeria, you must give us what we are due for in terms of salary, environment, and other things that can make our work conducive. And with that, we are going to give out our best. We are not saying we are not giving out our best, but it's the best possible for now. But I also believe that if they are able to do the normal things, definitely the nurses will perform better, and it will be better for all of us in the healthcare industry.
All right, sir. What actions can you suggest should be taken to reduce unprofessional nurses in Lagos State?
You mean the quacks?
Yes, the quacks.
Yes, it's unfortunate that we are having things so bad, and we don't even know where the thing started from. But I believe that everything will still rest on the government, because they are the one that can penalize. And if you look at the terrible health indices we are having in Nigeria today, the contribution of these people you have mentioned are the major issue there. They treat people after holding patients for a long time, and then the patient is about to die, they push it to the next level to go and die. And what can we do? Is to do everything to eliminate them. For everything that has a beginning must have an end. Yes, it can be a bit difficult, but the issue is that if we are really serious about the issue, definitely we are going to eradicate them. We cannot catch everybody, but we can make some people, deterrent. And then with that, others will learn. And I also want to tell you that one of the things that I've been militating against the struggle is because the fine, attributed to it in Nursing and Midwifery Council at 143 is very, very, poor, and they are capitalizing on that. So we have gone to the National Assembly and we have reviewed the law. So if you are caught, you are going to pay every penalty apart from the other sanctions. So we believe that will definitely reduce quackery, not in Lagos alone, but in Nigeria in general.
My name is Nosolawale Oladapo, the chairman AGPNP Lagos State. Well, I feel very good assuming the chairmanship of this association, and I believe the outgoing chairman especially has done wonderfully well with the members of the executive, and what we are trying to do is to build on their achievement, introduce so many new things that will make the association to compete favorably among the committee of professionals. Number two, we want to leverage on the technological advancement to ensure that our association is not left behind. We are planning introducing a kind of group insurance to make members to benefit, and we want to work assiduously with other professionals. And on quackery, it is a canker worm that needs to be fought. And like I usually say in a forum like this, that what we need to do in eradicating quackery is to ensure that we have what we call professional literacy. Professional literacy in the sense that nurses will practice within the scope, and again ensure that their practice is captured in what defines nursing as a profession. We are an integral part of healthcare system, and when nurses do well, the healthcare indices improve. That is number one. Number two, nursing is scientific and evidence-based. So whoever that anybody is dealing with in the name of all these charlatans, will know that they stand to gain nothing but patronizing registered nurses, their facilities, and as an individual will make them to appreciate what their health is all about. Thank you.
Conclusively, please let me tender an unreserved apology for the likely toes I have stepped, or even still stepping. At this point, I'm giving my stewardship report. To say, please, actions were never deliberate to ridicule or insult you, but you should understand that the cost of living is a tough one. Dear colleagues, I have sacrificed a lot to serve you. Note that I've defended your cause at all levels. Face the policy makers whenever I felt there is an observation of oppression to disturbing your peace, your practice. I promise to continue to serve you, as I believe that God shall reward with his abundant blessing. Thank you all. God bless you.
My name is Olaifa Clement. I'm the state chairman of the Association of General Private Nursing Practitioners. I've been in the position for 8 years now. And to God be the glory, we have achieved a lot. And people have celebrated God through us. And we hope that as the new people are coming, they will also start with new innovations, new ideas, and also to keep those legacy that we have already established. I hope that all of us here will be able to do the right thing. As we move forward, we believe that quackery should be removed in the health sector. Most of us, we are suffering because quacks have taken over a lot of things. And some of us, we are the cause of all this quackery in Nigeria. You know, not we alone, doctors, nurses, and many other things. So I hope that as we have really done to change a lot of things, like I mentioned in my address. If you look at my address, you will see that the new dawn we have made when we came on board. So those things that we have said that we did, we believe that those things now becomes old. And those who are coming, we have to do new things again. And I hope that every one of us will be able to do the best. And I hope that the Lord will continue to be with them. I hope they will do the things that is right. Thank you very much.